Okay, here we go. Some of you watching this video have never seen my face in your life. Others have been on this journey with me the whole time, and they just need a refresher. So I'm going to front load this entire story for everyone. My name is Caleb, and I have a thing called vestibular migraine. It has taken me 4 years to reach this diagnosis. I have seen my primary care doctor, 3 ENTs, ER doctors, 1 neurologist, 1 neurotologist, and 2 vestibular therapists. I have had 7 hearing tests, 1 MRI, and 1 CT scan. Now, you might be wondering, what is vestibular migraine? We'll get to that. But first, we're going to start at the beginning. So buckle up. During the first part of 2019, I began to notice that I couldn't hear high frequencies in my left ear as well as normal. I kept testing it by turning my head left and right towards a speaker or rubbing my fingers together on each side of my head to try and hear the difference. So I told my doctor, and they referred me to an ENT. In April of that year, I had my first hearing test. Sure enough, I had mild sensory neural hearing loss of high frequencies on both sides, with the left side being just a little worse. In May, I saw my first ENT to follow up on the hearing test that I had, but also because I was experiencing other weird symptoms along with my hearing loss, like tinnitus and a feeling of fullness. So he ordered 2 follow-up hearing tests to make sure my results weren't getting worse, and an MRI to check for acoustic neuroma. Education time. Okay, to explain all these medical conditions, I'm just going to use descriptions from the Vestibular Disorder Association, or VEDA, website, because they know what they're talking about. Acoustic neuroma is a serious but non-malignant tumor that develops on the sheath of the inner ear's vestibulocochlear nerve, also known as the acoustic nerve, which transmits both balance and sound information to the brain. As the tumor grows, it compresses the nerve, usually causing hearing loss, tinnitus, and dizziness or loss of balance. Back to the story. I had my second hearing test in June and my third in July. At the end of July, I went in for the MRI. The result? Nothing. Totally normal. With no answers, I asked for a referral to MUSC for a second opinion. For those who don't live in the southeastern U.S., MUSC is the Medical University of South Carolina. It's like our version of Johns Hopkins or the Mayo Clinic. More research, more knowledge, better treatments, etc. So I saw my second ENT, and after reviewing everything I brought to him, he said it was simply noise-induced hearing loss, the same thing that every human experiences in older age. I should mention that I'm a music producer and went to school for music, so I've had a long history of being exposed to very loud sounds all the time, more than the average person. Because of this, I accepted this diagnosis and was relieved that it wasn't anything more serious. Unfortunately, that wasn't the end of the journey. 8 months later, in April of 2020, I found myself in the emergency room. I was getting into bed one night, and just like any other night, and the second my head hit the pillow, the room started violently spinning. I panicked, sat back up, and woke up my wife, who was laying beside me. I managed to control the spinning by intensely focusing on an area of the bed right in front of me. If I moved my head at all, especially backwards, the spinning came back. So I thought I was having a serious medical issue because I had never experienced anything like this before. So I had a panic attack too. After deciding to go to the ER, I managed to slowly shuffle myself out of the house, down the steps, and into the car. The car ride was brutal. Oh, and to top it all off, there was a close tornado warning going on, something that never happens where we live. So there's that. If you haven't guessed it by now, I had just experienced vertigo for the first time in my life. When we got to the ER, they examined me for any signs of life-threatening conditions like stroke. I felt nauseous from the vertigo. I was dehydrated. My blood pressure was 90/40. So they pumped me with fluids and gave me meclizine. Meclizine is the primary ingredient in over-the-counter drugs for motion sickness like Dramamine or Bonine. It's an antiemetic that prevents nausea and also suppresses the vestibular system, so it's often used as a rescue medication for dizziness and vertigo. After stabilizing, they sent me back for a CT scan. The scan was normal, along with all the other tests they performed on me that night. So they sent me home with more meclizine, a referral to a neurologist, and a referral to vestibular rehab therapy. As you will begin to see, the presence of hearing and vertigo symptoms together take things to a whole new level of complication. Over the next several weeks, I had a few new symptoms show up. In addition to the ear symptoms from before, I had this general dizzy feeling, not off balance or anything, but also not normal, kind of like a vertigo hangover, I guess. I noticed that the dizziness symptoms got worse when I used screens for an extended period of time or went into stores that tend to be overwhelming, like Costco, for example. I became sensitive to sound, was fatigued, and had some head pressure, and of course, anxiety. Because I went to the ER, I was able to see the neurologist within a week or two. It was during COVID, so I had to see him through a video call. And because I had no neurological problems or history of migraines, he gave me a working diagnosis of Meniere's disease and a prescription for Valium. Education time. Meniere's disease is a chronic, incurable vestibular disorder that produces a recurring set of symptoms as a result of abnormally large amounts of fluid called endolymph collecting in the inner ear. The exact cause of Meniere's disease and its symptoms are not yet known. It may start with fluctuating hearing loss, eventually progressing to attacks of vertigo and dizziness. No treatment currently exists to cure Meniere's disease. However, medical treatments exist that can help manage it. Back to the story. For Meniere's disease, it's important to specify that the hearing loss is typically low frequency loss, and the tinnitus sounds more like roaring or rushing instead of ringing. But I didn't know these details when the neurologist first mentioned the disease. As I researched more, I found out that the disease tends to be degenerative, leading to deafness in some people. So naturally, my wife and I were really worried, and as a lover of audio, I was terrified. The neurologist sent me back to my first ENT for a follow-up, but he was not available. So the nurse prescribed me a diuretic, which is a common thing for Meniere's disease patients. Guess what? Rather than helping, the diuretic made me feel worse. About a month after my ER visit, I went to my first session of vestibular rehabilitation therapy, or VRT, education time. Vestibular rehabilitation is a specialized form of exercise-based therapy designed to alleviate both primary and secondary symptoms of vestibular disorders. VRT uses specific head, body, and eye exercises designed to retrain the brain to recognize and process signals from the vestibular system and coordinate them with information from the vision and proprioception systems. That's a hard word. The choice and form of VRT exercises will differ from person to person. So it's like physical therapy for your brain and balance systems. Back to the story. After several months of VRT, I was basically normal again. It fixed the residual dizziness I had been feeling since the first vertigo attack. I finally had some good news. But my vestibular therapist was not convinced by the Meniere's disease diagnosis, and after further research, I wasn't either. So she referred me to a neurotologist at MUSC who had a reputation for being the expert on dizziness in the Southeast. In case you don't know, a neurotologist is an ENT with additional education and training who subspecializes in the neurological areas of vestibular disorders. In August of 2020, I finally went to see the neurotologist. At this point, my symptoms were mild headaches and mild dizziness, especially during weather changes. Working on the computer made me feel worse. So the doctor ran a bunch of tests and examined me, including my fourth hearing test, which was still about the same as before. His diagnosis was that it was likely BPPV that sent me to the ER, followed by vestibular decompensation. He also said that I had probable vestibular migraine. Now, there's a lot to unpack here, so bear with me. Education time. Benign paroxysmal positional vertigo, or BPPV, is the most common cause of vertigo. It occurs when calcium carbonate crystals, or otoconia, that are normally embedded in gel in the utricle within the inner ear become dislodged and migrate into one or more of the three fluid-filled semicircular canals, where they are not supposed to be. It causes episodes of vertigo triggered by movement and changes in position. BPPV can be effectively treated with the appropriate mechanical maneuvers performed by a qualified healthcare professional. So the fact that it's mechanical in nature is important and makes it easy to treat and fix. Migraine is one of the most debilitating chronic disorders in the United States. Approximately 40% of migraine patients have some accompanying vestibular syndrome involving disruption in their balance and/or dizziness at one time or another. A large portion of people with migraine often have no accompanying pain, their predominant symptom instead being vertigo. Migraine and its variants must be addressed in the clinical setting by a combination of medical management and comprehensive testing and rehabilitation techniques that offer the most complete and lasting benefit to the patient. So, vestibular migraine is essentially a form of migraine that manifests itself through the vestibular system by vertigo and dizziness. Oh, and vestibular decompensation is when your brain kind of forgets proper communication between the three systems responsible for balance and spatial awareness. This is what causes the vertigo hangover or residual dizziness after a vertigo attack. Back to the story. According to the neurotologist, I had no clear evidence for Meniere's disease, but it's possible that I may develop it later. He told me to keep a diary of my symptoms, follow a low-sodium diet, take magnesium glycinate daily, discontinue the diuretic, and use a blue light filter for computers. So I left with the diagnosis of probable vestibular migraine, which means I only met some of the criteria for the full diagnosis. The neurotologist wanted to see me again in a few weeks to follow up. 5 days later, I had a severe throbbing headache on one side that put me to bed and lasted about 24 to 48 hours. Just wanted to slip that little detail in there. It'll come in handy later. A few weeks later, I followed up with the neurotologist on a video call. I had many questions because I was still having mild dizziness, more mild headaches, which always makes my tinnitus and ear pressure feel worse, and a general lagging feeling in my vision, which was weird. I also had a little light sensitivity at one point. He essentially brought my diagnosis from probable vestibular migraine to full-on vestibular migraine. Due to the migraine being a central nervous system problem and not a vestibular disorder, he told me that it would make more sense for me to see a neurologist rather than himself. So I left that appointment and began making new life changes to accommodate my diagnosis. But that didn't last long. Over the next 7 months, my symptoms gradually became more and more non-existent, to the point where I only felt weird after using a computer or phone screen for too long. I was beginning to doubt my vestibular migraine diagnosis because nothing was happening and I was basically normal again. I even felt better after stopping the low sodium diet. This meant that I no longer had an answer for what was wrong with me. So I went back to my original ENT, the first one, because I was wondering if maybe my issues were caused by either eustachian tube problems or TMJ, since I had a short history of teeth grinding and jaw clicking. He examined me and found nothing. I was normal. So much so that he no longer felt he could help me, and he referred me to his colleague who had more experience with the inner ear. That referral became my third ENT. In April of 2021, 1 full year after my big ER incident, I saw my third ENT. The audiologist tested my hearing and everything was still the same. After telling my story to the doctor, he said that despite everything I had gone through up to that point, he believed the hearing loss was noise-induced. He said that tinnitus and fullness typically happen in people who experience high-frequency hearing loss due to the compensation in the brain. He said the intense vertigo episode was likely either vestibular neuritis or BPPV, but more likely BPPV given the positional nature of it and the way it had resolved. He did not believe that I had Meniere's disease because I did not meet the diagnostic criteria, and he also didn't agree with the neurotologist that I had vestibular migraine. So I left satisfied with the answer, believing my symptoms were fixed by VRT and wouldn't return. And if vertigo did return, it would likely be BPPV, and I could treat it with the Epley maneuver, which is a body positioning treatment that fixes BPPV. 1 full year, another full year went by with no new symptoms. In July of 2022, I went in for a routine hearing test, still the same results. Then, all of a sudden, sometime in August of that year, I woke up one morning, rolled over, and had intense vertigo. I immediately had my wife bring me meclizine, but before I took it, we tried the Epley maneuver, but it was so uncomfortable that I took the medication instead. I managed to stop the spinning by rolling over into a different position. I went back to sleep. When I woke up, it was gone. The dizzy hangover that followed only lasted a day or so this time. So I went back to my third ENT the next month, the one that had diagnosed me with BPPV. He said that it was still likely BPPV that resolved itself and advised against taking meclizine if I can help it, because it inhibits the vestibular system from doing its job. I left the office with the same information as last time and felt normal for another full year. Well, until the next attack, of course. 1 year later, in August of 2023, I had another vertigo attack. It was identical to how it happened the year prior. Woke up, vertigo, medication, sleep. When I woke up again, I was fine, except for the hangover. I performed the Epley maneuver later that day, something that would normally trigger vertigo if the problem was BPPV, but nothing happened. It had been a while since the last attack, and I had a new drive to figure out what was wrong with me because I was never really confident in my diagnosis. So I began researching and reading scientific literature and made a new appointment with my third ENT. My hypothesis was that I had BPPV followed by residual dizziness, and I wanted someone to confirm this and rule out any other possibilities. During my appointment with the ENT, I told him that my goal for the visit was to confirm a diagnosis and walk out with all the tools needed to manage my condition. I presented him with all the evidence I found and asked many questions. He said he couldn't 100% rule out other vestibular conditions because that's not how medicine works. But his conclusion was that my first episode of vertigo was likely vestibular neuritis, and that the following episodes were BPPV. Education time. Vestibular neuritis is a vestibular condition that is commonly caused by the inflammation of the vestibular branch of the 8th cranial nerve, which is responsible for carrying the signals of the balance organs of the inner ear, commonly known as vestibular labyrinth. Those signals allow the eyes and the head to move in a synchronous way, which is a major component of dynamic balance. The inflammation is often caused by a viral infection and results in intense vertigo lasting several days. Back to the story. The reason he added vestibular neuritis to his previous diagnosis was because he did not think I should have had dizziness for so long after that first attack if it was only BPPV. This is where things start to smell fishy. He said that 80% of BPPV cases are self-resolving and the remaining 20% are fixed with a single Epley maneuver. He also said that if I found VRT to be helpful for residual dizziness before, then I can perform the exercises again to speed up the healing process. I mentioned some of the research I found, like a recent meta-analysis on the vitamin D supplementation for BPPV. He had never heard of it. I also asked if he thought I might have PPPD, education time. Persistent postural perceptual dizziness, PPPD, or 3PD, because that's the easiest way to say this thing. Causes dizziness without vertigo and fluctuating unsteadiness provoked by environmental or social stimuli, like crowds, which could not be explained by some other neuro-otologic disorder. 3PD typically starts shortly after an event that causes acute vertigo, unsteadiness, dizziness, or disruption of balance, but also may occur for unknown reasons. Treatment may include medication, vestibular rehab, therapy, and counseling. Back to the story. Regarding the 3PD, his initial reaction was that he didn't know what I was talking about. I disagreed that my first episode was vestibular neuritis. I left partially satisfied because my hypothesis was supported by his diagnosis, but it really didn't feel solid to me. And at this point, I felt similar to how I felt after my ER incident years before. The residual dizziness wasn't healing. So I started reading and researching everything I could on vestibular disorders, specifically BPPV. I joined a few dizzy groups on Facebook, so I could hopefully find others like me. One day, I noticed someone posted about a podcast called Talk Dizzy to Me and how it was their favorite podcast. So I went to Spotify, found the podcast, and binged nearly every episode. The show is hosted by 2 vestibular therapists, and I learned a lot, questioning my previous doctors and their diagnoses. While listening, I found out that one of the therapists was within driving distance from my house. Her extensive knowledge and experience in vestibular disorders shown on the podcast already had me trusting her. So I looked up her office and made an appointment. This person would become my second and current vestibular therapist. When I came in for my appointment in September, the therapist sat me down and took the time that is necessary to go through my entire history. She touched on every point, performed some tests, and diagnosed me with, drumroll, vestibular migraine. Turns out my hearing loss was likely a separate incident that was noise-induced. My third ENT was wrong about pretty much everything. The neurologist was definitely wrong, and the neurotologist's previous diagnosis corroborated this new and updated diagnosis. Out of all the medical people I had seen up to this point, my second vestibular therapist and the neurotologist were the most qualified and experienced professionals in the areas of my unique issues, so I finally trusted the diagnosis. And this brings us to the present day. After being misdiagnosed 3 times, researching as much as I possibly can, and reflecting on my symptoms and my family history, vestibular migraine makes a lot of sense. There is a genetic component to migraine, and a few of my family members on both sides have it. I used to get motion sickness when I was younger, never able to read in the car, which is a common precursor to developing migraine. Now, you might be wondering what this means for me moving forward. After all, isn't migraine just a headache? Well, if migraine is just a headache, then Godzilla is just a lizard. Allow me to explain. Not all migraines manifest with a headache. A headache is a symptom. Migraine is a neurological condition that can show up anywhere in the body. There are over 200 different types of migraine. Most people experience it as a debilitating headache, but others have vertigo instead, or stomach pain, and many more. Those of us with migraine actually have different brains than normal people. Our brains are hyperexcitable and more sensitive to various stimuli. Basically, we have an overactive nervous system, kind of, because that could mean other conditions, and we have an excited brain. The things that stimulate this response in our brains are known as migraine triggers, and they are unique to every person. But there are some common ones: stress, sleep problems, barometric pressure, food, complex visual environments, lights, sound, anxiety, to name a few. Normal brains can handle all of this with no problem, except maybe a little irritability. But migraine brains can become overloaded, and once they are pushed beyond their threshold, a neurological phenomenon cascades across the brain, which we perceive as a migraine attack. But people with migraine can experience symptoms in between the attacks as well. For me, the attack has been vertigo. Woo! My biggest triggers tend to be stress, anxiety, a sensitivity to complex visual stimuli like too much screen time, complex visual environments like Costco, and sometimes barometric pressure. My symptoms in the periods between attacks are typically brain fog, very mild dizziness, and very mild nausea. I say very mild because it's so mild that I don't feel comfortable telling people I'm dizzy. Everybody has their own definition of what dizzy means. It just feels like something is off, like I'm just unwell or just not feeling great. So now that I have a diagnosis, how do I treat it? Unfortunately, there's no cure for migraine. It will be my lifelong companion. But thankfully, I have a mild case, and there are many things I can do to manage and control it, perhaps even putting it into remission. Treatment is usually a combination of medications, VRT, and lifestyle modifications. My next steps are to find a neurologist who knows how to treat my condition and have them prescribe a rescue medication for when I get an attack. Since I'm overly reliant on my visual system, I will also find an eye doctor that has additional neurological training to get vision therapy and new glasses if necessary. For the periods in between the attacks, my vestibular therapist will provide exercises that strengthen my balance system, making sure that all the pieces are communicating well with each other. I also have to keep an eye out for my triggers, identify them, and try to reduce or remove them from my life as much as possible. Finally, I would like to find a counselor that can help me with the acceptance and anxiety that comes along with this condition. The goal is to try and lower the chance of an attack as much as possible by controlling the things that trigger it, having medications on standby for when those attacks do happen, and learning to accept my new normal. My main purpose for making this video is so I don't have to repeat my story 1,000 times to family and friends. When they ask, I can just send them a link. But I'm also hoping it will encourage others who may be dealing with these types of problems. I've learned a few things on this journey. Things like your primary care doctor doesn't know everything. In fact, no doctor knows everything. Every doctor chooses an area to specialize in. The best thing you can do is be your own health advocate. No one is going to care about your situation more than you do, and doctors have hundreds of patients that need attention. It is more than okay to disagree with doctors. If you think something is wrong, do your own research and challenge the doctor. It is also more than okay to ask for a second opinion or another referral. Find the specialist who knows what they're talking about. Will it cost money? Sure. But how much is your health and well-being worth to you? Anyway, that's my story so far. I hope I explained everything well enough for everyone. If you're a family or friend and you have questions, just text me. If you're a stranger with similar experiences, leave a comment. Thank you for watching this video that was way longer than it should have been. And cheers to a healthy future.